Welcome to The Explainer. Today we're going to talk about something it's a huge part of healthcare, but we barely ever think about it. We're talking about how something as simple as a ride can literally be the key to a healthier life. And that's a really powerful question, isn't it? Because, look, for millions of people, this isn't some hypothetical what if. It's their reality, day in and day out. A simple logistical hiccup becomes this massive wall between them and good health. But, and this is the good news, it's a problem that actually has a very specific and really effective solution.
Okay, so first things first, we've got to really wrap our heads around the core problem here. For so many of these vital appointments, the biggest hurdle isn't getting it on the calendar. It's just physically getting to the calendar appointment. I mean, think about the kind of care we're talking about here. It's the stuff that's the backbone of staying healthy, right? Your annual checkup, physical therapy, keeping an eye on a chronic condition. Now, none of these are sirens blaring 911 emergencies, but they are absolutely 100% essential. And when you start missing them, well, that's when you see delayed diagnoses, conditions getting worse, and way higher costs for everyone down the line. And that's exactly how a seemingly small transportation issue can just snowball into a major health crisis. It's a problem that hits our most vulnerable folks the hardest. The very people who need that consistent, reliable care more than anyone.
So, okay, that's the problem. Pretty big one, right? But what's the solution? Well, lucky for us, there's actually a dedicated service designed to tackle this exact issue. It's called Non-Emergency Medical Transportation, or NEMT for short. And really, the name kind of says it all. This isn't for those flashing lights 911 situations. It's for all that other crucial preventative care we were just talking about. It's a service literally built from the ground up to fill the specific gap in our healthcare system.
And this is where you really see why NEMT is a whole different ballgame from just, calling a regular rideshare. I mean, we're talking about drivers who are actually trained for medical needs, vehicles that are built to be wheelchair accessible, in true door-to-door support, not just curb to curb. So yeah, it's not just a taxi, it's a dedicated healthcare support service.
All right, so what does all this actually mean for the patient, on the ground? How does having access to this kind of service really change things for an individual? Let's break down how it works in practice. And this lays out such a simple, but man, is it a powerful chain of events. A reliable ride, it's not just a nice to have, it's the first domino. It's what makes everything else possible. It leads directly to that patient showing up for a screening, which can lead to early detection and, you guessed it, a much, much better health outcome. That ride, it's literally the first step on the journey. But the benefits don't even stop there. We're talking about tackling the massive problem of missed appointments head on. It empowers seniors to keep living independently, aging in place, as they say. It ensures people get to critical, life-sustaining treatments like dialysis on time, every time. And think about this. It gives so much peace of mind to family caregivers. This really just gets to the heart of it all, doesn't it? It's about so much more than just health. It's about dignity. It's about independence and safety for older adults who just want to stay in control of their own well-being. And like I said, these benefits, they don't just stop with the individual patient. No way. They actually ripple outward, making the entire healthcare system stronger for the whole community. Think about it. When people can actually get to their regular checkups, when they can manage their chronic conditions proactively, well, they're just far less likely to have a major crisis that lands them in the ER. And it's the same story for follow-up appointments after a hospital stay. Showing up for those is one of the biggest things you can do to prevent a relapse. Any MT makes sure those visits actually happen, and that helps keep people out of the hospital for good. And this right here gets to the bottom line financial truth of it all. An investment in transportation, it's really an investment in prevention. And we all know prevention is always, always more effective and a heck of a lot more cost-effective than waiting around for an emergency to happen. You can just see that ripple effect in action. By solving what seems like a simple problem, access, you get a direct, measurable drop in expensive emergency services, and at the same time, a clear boost in overall public health. I mean, it is the definition of a win-win. Now look, lots of people can benefit from a service like this. But let's zero in on the groups for whom NEMT isn't just helpful, it's an absolute honest-to-goodness lifeline. So whether we're talking about a senior who's had to give up their car keys, or someone who's recovering from surgery, or a patient dealing with mobility challenges, for all of them, the path to consistent healthcare completely depends on getting a reliable ride.
For these folks, care and transportation are totally intertwined. You just can't have one without the other.
And really, that's what this all boils down to. We can have the most brilliant doctors and the fanciest hospitals in the world, right? But our healthcare system is only as strong as its foundation. And that foundation is access. It's not an extra, it's not a luxury. It is the first, most essential step to getting care, period. When you start thinking about something like transportation as a core piece of our healthcare infrastructure, it really changes how you see things. It makes you wonder, right? What other simple kind of hidden barriers are out there in our communities? And how can we start working together to bridge those gaps and build healthier, more connected communities for every single one of us?